Thank you for inviting me to present at the ENF seminars. The automotive industry has long paid attention to the health effects of exhaust emissions, and the Japan Automobile Manufacturers Association, JAMA, has conducted health effect studies under its health effect subcommittees. I was also a member of the health impact subcommittees and have been exchanging views with WHO in Bonn and DG Environment in Brussels and US EPA and related research institutions with our research result. The ENS seminar organizer requested that the health effects research be presented with a focus on exposure. So I have chosen these titles. These titles, yes. JAMA, JAMA's health effect subcommittee is composed of atmospheric experts like myself and medical experts and policy experts. The medical terminology is difficult even in Japanese, and I apologize for my unfamiliarity with technical terms, but I'm familiar with the activities of JAMA's health effect subcommittee's activities as a whole. Oh, thank you. This is JAMA's health effect subcommittee is source of the funding for health effects research, and the actual research is conducted primarily by the Japan Automobile Research Institute, JARI here, yeah, and also in part within Toyota. Studies are classified into 3 categories based on size and shown here. The first one is in vivo studying. In vivo studies use in vivo studies are experiments that examine tissues changed and changes in ecological functions through exposure experiments on animals as close to as possible to the respiratory systems of human bodies. In vitro studies use human cells to examine genetic mutation and cellular inflammation and toxic damage. Since it does not deal with organs, it is a more indirect study of effects of humans. However, it is most recent mainstream study for standpoint of animal welfare, and in addition to allowing free setting of exposure conditions. The final epidemiological assessment is activity to clarify the risk of health effect of automobile-related substances based on the result of in vivo and in vitro studies and from exchange of information with world literature and experts. Okay. This is a schematic diagram of in vitro and in vivo and in vitro exposure studies at JARI. First, we set the emissions. We used real model engine, diesel engine, and old ones. Sometimes we use full vehicles. When we use full body vehicles, we put on the vehicle on the chassis dynamometer, and engine controlled emission is transported to the in vivo chambers. In first stage, we used like this in novel exposure systems to expose animals. But when we do this experiment, small animals might be fixed on the small chambers and tighten their bodies. It's very stressful for animals. So we changed it to the whole body exposure system like this. This one is a novel exposure systems chambers, and this one is a full body chambers. You can see 4 sets of full body chambers. In this chamber, we can use up to 1,000 animals at the same time. And next one is in vitro studies. We transport this diesel emission to the human cells. This is the human cells exposure systems. We use human cell lung cells incubated in cell culture mediums. And finally, we analyze by using the physiology and histotherapy testing or molecular biology testing like this. This one shows a history of the health effect studies in JARI and JAMA. First, JARI and JAMA studies reflect to the public opinions and the concern of the automobile manufacturers. We health impact subcommittee groups makes the study designs, research design, and the research design is transferred to the evaluation committee groups of university faculty groups, and they reviewed our research design, and they agreed we go forward to this kind of studies. First study is taken in before 1980s. It named HELP studies. This focus on the carcinogenics. This result is study result is also reviewed by the evaluation committees, and finally we published the research result. And this theme is changed year by year by public concern. So first is carcinogenics, and second one is the bronchi COPD studies and allergy studies, ECD studies, and cardiovascular studies, and asthma and toxicology and children studies. And current one is brake and tire wear dust studies, because as you know, in the combustion engine changed to electric vehicles, but electric vehicle use brake and tire wear. So and additional in addition to the this theme, EV vehicle is very heavy due to because they load very heavy batteries. The brake and tire load is very high. So we concerned about the brake and tire wear dust currently. First, I would like to show the health studies. This is a health study starting from 1978 to 87. As you see, this is a graph for incidence of the lung cancers. When we expose diesel smoke to the rat, this is a very clean rat. Lung organ is very beautiful. But when we when we exposed liquid diesel exhaust, the lung organ changes like this. And sometimes squamous carcinoma, it can be found like this. When doing through this experiment, we found diesel exhaust exposure increased in incidence at lung cancer at over the high concentration of 2 milligrams per cubic meters. As you know, the International Agency for Research on Cancer, IRAC, is part of the WHO group. And in 1988, IRAC classified diesel exhaust as a probably carcinogenic to humans. So they classified diesel smoke is group 2A. But this is one of the related examples for exposure systems. Next one is COPD studies, but the time is so limited. I would like to show the final result shown like this. Diesel exhaust affected some parameters of the respiratory function at high concentration, but this study was done by nasal exposure system like this, so it's very complicated, and the animal number is very, very low. And next one is the allergy studies for pollen allergies. Sometimes diesel and the pollen allergy affected to the allergy systems increased. But when we exposed cantaloupe dust plus pollen, the same situation is occurred. The diesel exhaust exposed increased the number of the anti-cedar pollen Ig positive mice, same as the cantaloupe dust. And next one is ECD studies. And this another one is a PM 2.5 studies like this. And final one might be the asthma studies like this. This one is done for 3 years. So pathway remodeling studies. To expose to the diesel emission did not worsen the inflammation increased by the olbamium inhalation. And this one is not direct exposure, but in vitro assessment using another way to exposure. This one is used judges for the PM toxicology. From tailpipe and ambient, we collect the PM samplings like this and classify two stages of the filters, and they washed and PM component is washed to transfer to the bottom of the cells by using the SOX-ray extraction. And finally, they solved by the DIMSO and makes liquid samples like this. And we use these samples to evaluate by cytotoxicity and gene expression and the DDT assay, something like this. This one is the one currently we are doing the developing the database for the toxicity of automobile emissions for the use for the predicting toxicity. The substances like this, we use aromatic hydrocarbon or nitrogen or something like this. And assay is showing this. DDT or mutagenicity or cytotoxic assay or gene expression something. And we collect data and accumulated the database and for the prediction of the future engine emissions. And this one is one of the result of the ambient PM component toxicity. This one is PEH, polyaromatic hydrocarbons, and NPH, nitrated pH. And you can see high toxicity, high pH and NPH can be found in fine particles. This line is the fine particles, and this line is the coarse particles. Maybe 10 times higher concentration is accumulated in the fine particles. But this one is taken at the urban background, and this one is roadside. We can see no changes. So in this moment, in this graph, PM, roadside PM and urban background PM have the same concentration of pH and NPH. And this one is the Ames test. Mutation is something occurred by these kind of toxicitants. And you can see it's high mutation is taken in large particle, coarse particle, I'm sorry, small, fine particles. This one's scale is different. So the same result is the same. From the Ames test, also reflects for the toxicant in PMs, and PM fine is very dangerous comparing the PM coarse. And this one is a cytotoxic assessment for ambient PM, and we can see ambient PM does not have the serious toxicities. And this one is oxidation potential for ambient PMs, and you see the coarse particles shows a higher oxidation potential comparing to the fine particles. And in this moment, roadside particle is a little bit higher comparing to the urban background particles. But the coarse particle had a high oxidation potential. So it is case by case. For the toxicity, fine particle has a high concentration of toxicity, but the oxidation potential shows the coarse particle is larger. So it's very difficult to explain totally. So from this, I would like to show the example of overseas exposure studies. This one is animal exposure testing for US EPA Research Triangle Park. They use chassis dynamometers put on the vehicle in the chambers. Is shed systems. It controls temperature and pressure, something. And the vehicle emission is checked by the emission analysis and transfer to the whole body exposure chamber and nasal exposure devices. And full body chamber is like this. And this one is animals, but when animal is just animals. So US EPA use testing the humans. A voluntary human is sitting in this chamber and exposed full bodies. And sometimes they use nasal exposure devices and something they jogging in the, during the sneezing the diesel exhaust. And they after they exposed maybe 1 or 2 hours, pulmonary lavage and collection of the object and medical testing was conducted. And sometimes they measure pulmonary function test. This one is a human exposure systems. And this one is ambient exposure systems. They analyze the same way, but the input PM is different. They collect ambient PMs and condense to these systems. They call it to the capsule systems. In this system, ambient PM is condensed to 2 or 3 times higher concentrations and exposed to the same way. This is a very unique system. But when they use this kind of systems, smaller particles cannot be collected. Only large particle can be condensed. This is one problem. This is another chamber, another institution's exposure chambers. This is a University of Toronto using this kind of chambers. And they focused on the metal particles. This chamber is settled by the very narrow street of the passing by the tram, and they collect ambient PM and gas and transfer to this chamber, and they see how much the metal particles is affected to the human health. And this one is the University of Washington chambers. They are focused on the aged PMs. They use diesel exhaust. But they condense or dilute to this duct 1 or 2 hours and makes aged gas and PMs, and they inhalate the test human is inhalate exhaust inhalated in these chambers. And this one is a European exposure center. Helmholtz Center of Munich is main inhalation system they use. This one, you can see this one is a nasal exposure system, but the whole body chamber they have, and the same way they use mice and rats using testing is conducted. And this one is the US exposure centers, Lovelace Respiratory Research Institute. And this one is exposure studies for asthma patient and non-handicapped person walking on the sidewalks of Oxford Street. This one is very dirty street and clean area. They worked Hyde Park and they compare the result. But the result is written here. Decreased lung function was observed, but no statistically significant difference is in asthma symptoms. And this one is another study for measuring the nanoparticles. When we work on the roadside street, sometimes maybe 500,000 particles of nanoparticle in cubic centimeter might be existed. So we observe very high nanoparticles at the roadside when the heavy-duty trucks passing by. Many nanoparticles were observed when the heavy-duty trucks passing by at the intersection on the trunk roads and from the vehicle stopped at the red signals. And this nanoparticle is very attracted when the Professor Oberdoster of Rochester University, New York, attracted a lot of attention with his presentation of translocation of nanoparticles in the body. When we absorb the nanoparticles, the nanoparticle is transferred from the olfactory nerve to active nerve. So in the brain, it's easy to transfer to the brain. Or alveolar surface to intervascular transport was found. And sometimes in brain, metals nanoparticles can be found. So in this presentation, Japanese National Institute for Environment Studies construct nanoparticle exposure laboratory building in 27th. This one is a buildings, and in basement they put on the diesel engines like this and transfer to the second floor's whole body chamber systems. And they found some hypertrophy of lung external tissue can be found, but the effects of specified to nanoparticle have not been confirmed. Nanoparticle is measured from our side before the needs studies in 24. We found nanoparticle in truck exhaust have drastically reduced particle number at 2 meter height. This one is a 3 meter height, and this one is 1 meter height. The difference is 2 meter, and between the 2 meter, the number is drastically reduced. And high volatile component and unstable is found. Previous in vivo experiments have also included in nanoparticles, but no in particular impact can be found. So the summary, since 1990s, JAMA has been conducting the research on health effects of automobile exhaust in order to answer the public concern, which vary from year by year. In addition to measuring the toxic substances in vehicle exhaust, roadside air, ambient air quality, JAMA have clarified the relationship between toxic substances and health effects through the whole body exposure chambers explained on small animals. In advance in automobile exhaust purification technology have reduced the amount of the toxicity in exhaust gases, making health effects undetectable. This have made long-term exposure of small animals to 3 generations from parents, children, and grandchildren necessity. So it takes a long time. Due to the difficulty of expressing health effects and from the perspective of animal welfare, exposure study using cultured cells were initiated. JAMA continues to conduct health effect studies targeting for health effects on children and elderly and vulnerable, highly sensitive individuals. But there is a concern about the health effect emissions from poor fuels and unmaintained vehicles in developing countries where the traffic congestion is common. So many health effect impacts from the big emission can be found in developing countries. This is my personal opinions. Thank you very much for your seeing my presentations.